Dr. Jonas Apostol.
Hi guys, so another day, another week, another script. Hi guys, so another day, another week, another vlog. So this case is quite similar to the case that we uploaded last week, no? So medyo almost always yung mga inquiry ganito. Sa mga platform ng social media namin like YouTube, Instagram, super dami, they're really into this kind of treatment because ang daming problems like premature extraction of the teeth that it could have been saved pero hindi na kasi pinabunod. So this patient went to my clinic with a chief complaint of having this not so aesthetically pleasing denture, and she's afraid of that might fall off while talking or riding in a roller coaster. So medyo she's not confident about the functionality, the looks, and also the capit. So natatakot siya, and at the same time bumababa yung self-esteem niya. It's because of the condition of her teeth. So the patient is on her 20s, no? Mid-20s, pero may problem na ganito. We don't want this to happen, especially for mga batang like on your 20s pa kasi as much as possible we want to save the tooth, to save the bone that holds the teeth. Kasi once kasi na nabulutan ng nangyayari, the bone will resorb, okay? It will affect the face, okay? So, pag nangyari yun, mukhang tatanda or magmamature yung mukha mo in the future. We do comprehensive assessment, okay? So based on her case, the best treatment pa rin would be dental implants, but it requires bone augmentation. Pero sa patient, you know, she doesn't want to go or to undergo those surgical procedure. Pero that's actually the best treatment. The second best would be bridge or dental bridge. So let's talk about the patient's case. As you can see here, she's wearing denture for almost a decade, 9 or 10 years na. As you can see here, it's not evenly proportioned, and the height of the central incisors and the lateral are not parang evenly proportioned. And we have to check also some details on the distal extent of the upper right area, which is a little bit collapsed, and therefore giving the patient this parang mapangil na appearance. So the patient was using a stay plate denture, which is not that, you know, the perfect removable denture for this type of case. It's because of its design. Wala masyadong support. That's why it's unstable and she's afraid na mahuhulog while talking. So you can see here when she removed her removable denture, there are 3 teeth that were extracted. No. Also, as you can notice, may mga cavities din siya on the lower and some problems also on some other teeth like the lateral, medyo may mga cavities din siya doon. So we don't want to fix the appearance without improving the health of the teeth. So these problems must be resolved, of course, prior to complete the treatment. So health is very, very important. We then did the smile design. So with the smile design, I used the composite here to create a more proportioned, evenly distributed sets of teeth. So most of the time, the patient has fear of the possible outcome of the treatment. That's why we are doing this smile design before we do the final preparation. Okay, so that the patient would have the idea about the future look of her teeth in relation to her face. So, nung nakita ng patient, nung itsura ng kanyang design, nagka-hope siya na mas gaganda pa pala. So, after the design, syempre, we discuss also some few modification here. Let's say, the color of the teeth na gusto niya. So, because she has a fair complexion, she requested with a whiter shade of the ceramics. So I agreed naman kasi we also have plans on doing the lower teeth para magiging balance siya. So this is the preparation. I prepared the teeth accordingly. I mean, based on the design. That's why we do the designing first to make sure that we calculate everything. We don't want to remove anything that is parang sound, tapos it should be calculated, and all the unsound structures or the cavities must be removed, and we have to make sure that we are following the proper preparation in relation to the smile design, because sometimes if we do preparation right away, it will affect the design and we won't be able to get the design that was promised to the patient. So everything's measurable and calculated here. So in my practice, because I am really OC about the preparation, I use a loop. Okay, it's a dental loop. I have 3 times magnification and 5 times magnification to not miss the cavities. No, we have to make sure that every unsound structures must be removed, and also following the parang natural morphology of the teeth na hindi siya mako-compromise. So the material used for this treatment is zirconia for both bridge and veneers. Okay, so we layered it with porcelain. I always layer my zirconia with porcelain to ensure that it is lifelike. Okay, I don't really put too much. I mean, the thickness of the zirconia is not too much, especially on the veneers, because we want to incorporate the porcelain also.
1 week later.
So after a week, we did try in to the patient. We made sure that everything's fine and perfect, no? Especially the fit. So after agreeing with the result, and she's happy, we actually did a little bit of modification, especially on the height of the teeth, kasi we don't want to put some super long naman na hindi bagay. So we did a little bit of modification just to follow the curvature of the lower lid, and also yeah, she's happy. We did the glazing, and the same day, yun na, kinabit na namin. So for this case, I did a 6-unit bridge combination treatment with veneers. I did the veneers on the premolars kasi I don't need to extend my bridge to the premolars because it's enough support naman. Kasi sometimes with bridges, it's really difficult to clean it, especially on the around posterior area, because it requires a special floss to be able to clean it well inside the gums. So the process was very, very fast. There was no problem, especially with the teeth, no, kasi it's not indicated for root canal. Usual problem kasi pag tumatagal, especially pag the teeth are severely carious, that it should require root canal treatment, dun na tayo tumatagal. But for this patient, super fast, and with it great, super bilis ng transition, and she's happy. We're actually looking for another time for the lower naman to be able to match the color of the upper. So here is the final result. As you can see here, it's proportioned, well distributed, and the color is in harmony with the patient's skin tone. And she's happy with the result as well. There are some incisal translucency that would make the teeth look natural, and everything went well. The sizes, the width, and super bilis ng transition. It took the patient like a week to be able to feel the teeth like a normal part of her body na. So the goal in the clinic always is to provide a natural looking smile, no? be it bridge, crowns, veneers, implant, we want to give you the best result that would really blend with your face and with your personality. So sometimes kasi when we do this type of smile transformation, it will take a while for the patient to feel teeth like it's part of her body. Pero yeah, for some, mabilis. For this type of patient, for her, it took her like a week. It feels like super okay na. So always remember that you have to take care of your mouth because our mouth and teeth, okay, are really, really important. And there's a saying that our mouth is the gateway of our overall health. So take care and God bless.